Order. End of question time. The clerk will now proceed to read the order of the day.
Item 1, resumption of debate on the motion Building a Healthier SG.
The question is that this House endorses Paper Command 19 of 2022 on White Paper on Healthier SG as the basis to transform our healthcare system by A, focusing strongly on preventive care, B, fostering lasting relationships between residents and family doctors, and C, building strong partnerships within the community so as to support individuals taking care of their own health and wellness and strive towards our vision of long and healthy lives for Singaporeans. Ms. Sylvia Lim.
Mr. Deputy Speaker, as members of Parliament, it is not unusual at our Meet People sessions to encounter residents with serious health or mobility issues. For them, a short trip to the MPS is itself a difficult journey. Some of them are around my age. As I learn more about their circumstances, I often ask myself whether the quality of their lives might have been drastically better if they had had the correct interventions and advice at an earlier stage. I tend to see this particularly in residents of less means. On today's motion on the Healthier SG White Paper, I wish to focus my speech on three areas. 1, the potential of Healthier SG. 2, clarifications around capitation funding. And 3, to conclude with the importance of a whole-of-society buy-in. First, the potential of Healthier SG. A key thrust of the Healthier SG White Paper is that residents will be encouraged to enroll with a family doctor even when they are well, so that they may benefit from advice regarding social interventions to adopt healthier lifestyles. It is envisaged that the doctor will take charge of the overall well-being of the resident for a period of time, rather than to treat the patient on an episodic basis. This holds much promise for a healthier nation overall. In moving the motion yesterday, the Health Minister assessed that the returns of better health outcomes from Healthier SG would take maybe 8 to 10 years before tangible results might be seen. However, on returns based on dollars and cents terms, there are encouraging experiences from overseas. Prevention strategies have been shown to make economic sense as they are substantially cost-saving. It is well known that it is preferable for healthcare systems to aim to prevent ill health rather than to subsequently treat it from a financial standpoint. 5 years ago, a systematic review was published assessing the returns from investing in public health interventions such as promoting well-being and preventing ill health in society. From 52 studies of healthcare systems in high-income countries, it was found that the return on investment, or ROI, of public health interventions was at a median of 14 to 1. That is, for every $1 invested in public health, $14 will be subsequently returned to the wider health and social care economy. Although we do not yet know what returns Healthier SG might bring in dollars and cents, there is reason to be optimistic. From the healthcare system standpoint, it is vital that the focus on prevention ease the pressure on our acute facilities. Even as we debate today, residents experience very busy A&E departments in public hospitals in the past months, with patients sometimes waiting more than a day at A&E before being allocated a ward bed. On this front, I note that in the White Paper, the Ministry has listed 22 indicators to assess Healthier SG by, including indicators of easing the load on acute facilities, such as reducing the avoidable emergency department attendance rate and reducing the admissions of the elderly for fall injuries. If achieved, these reductions will bring relief to patients and staff at acute facilities and contribute to better care for those most in need. That said, I have 2 further observations. First, to seek clarifications on the move to capitation funding and how healthcare outcomes will be safeguarded. And second, to conclude with the importance of a whole-of-society buy-in to the plan. First, on capitation funding. At Chapter 5 of the White Paper, it is stated that to fund Healthier SG, the government intends to roll out capitation funding first to family doctors and then to the geographical healthcare clusters. There are scant details in the white paper about how this would be implemented, and the minister yesterday did give a few more details. I would like to ask how the government intends to ensure that the move to capitation funding does not undermine access to healthcare and the quality of healthcare. As stated in the white paper, capitation funding will be a shift away from the current funding model based on services provided, commonly called fee-for-service or FFS models. The ministry has pointed out that capitation funding is in place in healthcare systems in other countries, such as in Europe, New Zealand, and the United States. Yesterday, the minister pointed out that general practitioners here are also not new to the concept. For Healthier SG, the minister stated that besides the annual servicing fee paid to healthcare providers, there would still be separate subsidies for patients' medicines and screening. The ministry's stated objective for adopting capitation funding is to, and I quote, create an inherent incentive for healthcare providers to focus on preventive care and right sighting of patients, unquote. Put another way, healthcare providers who keep patients healthy and do not overservice their patients will benefit under a system of capitation funding. So if capitation funding means that patients can go to the doctor for consultations at minimal cost, this potentially will encourage poorer Singaporeans to consult doctors to work out health plans. If successfully implemented, it will go some way towards reducing healthcare inequality. At the same time, capitation funding has been the subject of research in many countries, particularly on whether such funding has led to healthcare providers to function as economic agents. That is, instead of focusing on the patient's best interests, healthcare providers look at the financial bottom line and behave in certain ways which may not be in the patient's best interests. I'm not saying this will happen for Healthier SG, but we should be alive to the risks. There is evidence from several studies overseas that capitation funding models tended to result in patients receiving less treatment. That is, they went to the doctor less frequently, and their treatments tended to cost less than compared with the FFS models. It is often not clear whether this was a result of capitation working well by cutting down unnecessary treatments and waste, or whether, on the other hand, patients were in fact underserved, that is, not getting adequate treatment. It also goes without saying that the level of funding is key. If capitation funding is pegged more generously, the quality of care would generally be better. Some studies focus on doctors' own assessments of whether the way they treated patients was different under capitation funding compared to FFS models. There were indications that some physicians believed that funding had affected their choices of treatment. There has also been concern whether capitation funding would lead to healthcare providers cherry-picking their patients. In other words, with a fixed annual servicing fee, it might make economic sense to choose healthier patients rather than, for instance, older patients with health problems. Coming back to Healthier SG, I'm pleased to note that the white paper states that the capitation funding formula, quote, will be tiered based on the health risk profile of each enrolled resident, scope of required care, and the progress made in terms of preventive care or chronic disease management, unquote. Could the ministry clarify what level of granularity will be used to tier the funding? For instance, will the funding be tiered based on the disease diagnosis and the stage of disease progression? Yesterday, the minister also touched on the overall finance and budget implications of Healthier SG. He said that the setup cost over 3 to 4 years would be about $1 billion, while there would be recurrent costs of about $400 million a year, including the annual servicing fee for patients. Does this mean that the ministry has already worked out the detailed capitation sums for each health risk profile? And when will this information be published? So my final observation is that for Healthier SG to succeed, there needs to be a whole of society buy-in. Each of us needs to make adjustments to our daily lives. To illustrate the possible difficulties and inertia, please let me share a personal anecdote. Over the weekend, I met some friends for a meal. As they continued to order local favorites such as char kway teow, fried Hokkien mee and others, I asked them whether they had heard about the Healthier SG plan, which would be debated in Parliament this week. They gave me a quizzical look and, without blinking an eye, continued to order more of the same. So this amplifies the monumental task ahead to get population buy-in for changes to deep-seated lifestyle habits. Besides having incentives to consult a family doctor regularly, there will also be a need for a supportive infrastructure and to change mindsets. On infrastructure, the government has built sporting facilities and beautiful park connectors for Singaporeans to exercise in. Besides that, healthier food needs to be affordably priced so that less privileged Singaporeans can afford to make healthy choices daily. Whatever the case, in the final analysis, changing people's deep-seated habits might be the most difficult of all. So let me conclude. This motion to focus on preventive care as a key thrust in healthcare should be supported. It holds the promise of meaningful and fulfilling lives for Singaporeans into old age, and if implemented well, can help reduce healthcare inequality. It is likely to be money well spent. At the same time, based on studies overseas, there may be risks associated with capitation funding. I hope the Ministry will clarify in due course how the funding model will be implemented so as to minimize any compromise on health outcomes. Finally, for Healthier SG to succeed, a whole-of-society effort towards healthier living, including changing some deep-seated mindsets and habits, will be needed.